Yeah, Patterson has been an important partner in introducing technology into our workflow and into our practice. We had a few times that some prime scan machine was brought into our practice, so we can get a feel of what the technology looks like. So with technology, it improves the workflow. It makes the daily work very efficient. So, for example, a lot of patients, they appreciate getting their restorations and dental work done in one appointment, and that's exactly what CAD/CAM technology, including prime scan and prime mill, help us to do.
Dr. Ali, when the pandemic hit, took some time to reflect on really what he wanted his practice to be. When we first set him up, we did have kind of a blueprint and a design of what we could afford and what we could do at this stage. And then as the practice grew, we wanted to add in technology, in particular CEREC. I think one of the things with Dr. Ali is when he did buy the technology, the CEREC and the cone beam, that technology, particularly CEREC, helped him in the pandemic. Because as you remember, Minnesota shut down the last month of April and May, and then they opened up back again to see patients. And by the fall, he had decided to invest in this technology. And I think having that technology really separated his clinic from a lot of the other clinics.
I think that gives us an edge over practices around us. This technology, is not, although it's available, it's not very prevalent among, dental practices. And that, I think, makes us stand out as a practice in a neighborhood like this and make our practice a high-tech practice where we can deliver, dental care using, the latest technology.
When we're working with the customer, we really like to be able to take a lot of the process off the plate of the dentist. So when we get to the design laid out and we get it to a point where they're happy with and what they really want from their vision, we then take on that role of working with the contractors and architects to really help create that dream that he came up with initially on the design.
And Kevin and and other staff, including Andy, they have been wonderful, kind of being patient with us so we can get a feel of the technology and kind of go through the decision process of getting the technology and kind of introducing it to our practice. Patterson, they've been really helpful in introducing the technology into our practice, and one of the things that they did was having a training day where we closed the office and all our staff were trained on scanning an arch and milling a crown and getting our feet wet in introducing technology into the practice.
So it really starts with our territory representative, because ultimately he owns the relationship with the office, and just through conversation with the doctor and staff, they would let him know that they're interested in adding digital impressioning, for example, and that's how it happened here at Lakeshore Dental. And Kevin had gave me a call and came out. We did a demonstration with the digital impression unit. Went well, and then after that, we installed the equipment here at Lakeshore Dental, and it was maybe a year later, doctor was doing great with the technology. We wanted to take it to the next level, and that would be turning it to a full-scale CEREC system.
I'm very futuristic, and our work, I always think, how can we make things better? And technology, I think, is a tool that we can use to provide better care for our patients and also make our life easier. Because the old way of practicing dentistry it's been a little tough, I think, and technology, I think, with the help of technology, I think we can make the life of the patient easier, or workflow easier and more efficient, and I think it's just better for everybody.